Sean McWilliams. Great to have you here. Happy Wednesday, everybody. Welcome to our live that we do every Wednesday, unless we have some sort of technical difficulties. But today we're going to be talking about a really cool subject, so we'll get right to it. If you're new to our group, welcome. It is wonderful to have you here. And if you have a question, please don't be afraid to ask in the comment section and let us know where you're from. And it's great to have you here. And if you are a veteran and you've been with us for a long time, welcome back. It's great to have you here. It's great to be here to share this information with you. We are a community that is growing for people who are looking for non-surgical approaches to their chronic back pain. And so I'm going to show you some really cool stuff today. So it's so great to have you here. So let's get on with it. So, there's some questions I think that we all ask if we've ever dealt with back pain, and I am in that group, just so you know, so you are not alone. But here's some pretty common questions that most people ask. Why does my back keep hurting me? Am I ever going to have to get surgery? Like, is that going to be the end point to this for me? Am I ever going to feel good again? Will I always have pain in my back? What if my back pain keeps getting worse? Will I be paralyzed someday from it? It's not a good thought to have, right? Will I ever feel like my old self again? Are you afraid that you'll always have back pain? A lot of people are, because they feel like they've tried everything. They've tried everything and nothing has worked. So they figure, am I just always going to have to live with back pain? That you might not ever get to work again and provide for your family. I've seen a lot of people, unfortunately, in those situations. It's the whole reason that I do this. Of a story sometime, if you've been with me, you probably know. If not, I'll tell it to you sometime. That just always opens up my heart and makes me know that people need to be aware of what we're going to share with you today. That you'll never be active again. That you'll never be the spouse that you want to be again, and have the relationship and be able to go and do the things that you loved to do with your significant other and share life together again, because you have to say no because your back hurts you chronically. That you won't be able to play with your children or grandchildren how you'd like to, or that maybe you'll just wind up in a wheelchair someday. Those are real questions. And I asked myself those questions as well. A lot of people, if you're new here, probably don't realize that I injured my spine really badly. And here's a picture of it. I hope it doesn't gross you out. But this was me after a bad fall at the skateboard park probably 4 or 5 years ago, and that was my low back. And that was, I was asking myself those exact same questions. Was I going to be able to work again? I had 2 little boys. Was I going to be able to take care of them? Was I going to be able to provide for my family? Even more than that, would my back pain ever go away? I mean, I was hurting bad. And I was almost guaranteed in my head that I had fractured my spine, which scared the crap out of me, of course, as a non-surgical spine specialist, and how to manage that. And I want you to know that I managed this situation without surgery, without getting addicted to narcotic drugs and opioid medications and numbing it, but actually rehabilitating my spine. And that's one of the things that I'm going to do, and I'm going to show you today on how we want to go about doing that. So you're not alone, okay? I've walked in similar shoes as a lot of you have with things like this and managing them, and I want you to know that you can do it. It's possible, all right? So let's talk about this for a second. What causes back pain? Because when you have back pain, it starts to become a mystery. You have MRIs, you get x-rays, the doctor maybe does testing on you, maybe your chiropractor does, and you're trying to figure out what causes back pain. Well, I want to really get this precise for you, and I want to give you some information to help you feel confident about understanding what's going on with your back. So the 2 causes of back pain are the spinal disc is number 1, and this goes for the neck and the low back, and number 2 is the facet joint. All right, so if you're not sure what those are, let's go take a look at them. So number one right here is the disc. So the disc is the number one source of pain in the spine. Okay, and when we say disc, it's made up of two parts. It's made up of these outer rings called the annulus fibrosus. They're calling it annulus right here. And it can cause pain in your back because it can tear, as you see right here and right there, there's a tear to this. And when it tears, the outer 1/3 of the disc, where you see me drawing this red right here, has things called nociceptors in them. Nociceptors run all the way around the disc, the outer 1/3 of the disc, and a nociceptor is a pain receptor. That's what it does. It picks up signals of pain and tells your brain that there's something going on. So that is the number one big source of pain in the spine, is when the nociceptors get irritated, usually due to degenerative disc disease, and the discs start to tear like in kind of an old dried right out rubber band that's been in your junk drawer for a couple years and doesn't have that elasticity. It starts cracking and you go to stretch it and it breaks on you. Same exact thing in the disc if you don't keep your discs healthy. So you got to keep your discs healthy, okay? And the other thing that can do it is if this jelly in here called the nucleus starts to exit out of where it's supposed to be on the inside and start to protrude where it starts to push onto the nerve branches. Okay, so both of those areas of pain can be caused by some form of degenerative disc issue. That can be a bulging disc, a herniated disc, degenerative disc disease. Those are going to be your big ones. Okay, so that's the number one source of pain. Here's another view of it, just so you know. So what we're doing is we're looking at the disc like this. So this is the disc. This is the inner part where the jelly is, called the nucleus pulposus. This is your spinal cord. And what you can see right here is you can see this hole where the nerve comes out, and that nerve is called the neural foramen. So that's this red area right here. Okay. And that is a foramen is the definition is a hole in a bone where a nerve or a blood vessel travels through. Okay, a hole in a bone where a nerve or a blood vessel or both travel through. That is a foramen. So anytime you see the word foramen, you know there's one of two things going through that area. So when you look over here, where I've drawn it in red at on this other side, this is the nerve branch. Okay, so the nerve branch is exiting out, and where I fill it all in right here, that is actually one of your spinal nerves that comes off of your spinal cord right there. This area is where your spinal cord goes. It's called the thecal sac, without getting too in depth with this. So if a disc starts to push anywhere, okay, out into this area right here, you're usually going to get pain in a lot of people. So that's how you can get discogenic based pain, where it's coming from the disc itself. The other part where we can get pain at is the facet joint. And when I say facet joint, now we're going to look at the back of the bones. That is, bring it up here so you can see it. That's this area right here. So it's this piece and this piece together on both sides make up the facet joint. And what does the facet joint do? Well, it allows you to have movement and motion. So you do a back bend, it allows you to move. You bend forward, it allows you to flex forward. You bend to the side, it can let you move like that. So that's the purpose of a joint, is movement. And if it doesn't matter if it's in the neck or the low back. What can happen though, if you don't take care of your facet joints, and you're like these kids, like have their chins down on their chest, or you play a lot of sports where there is micro and macro traumas, those facet joints can go from nice and smooth to very rough. When they get rough, that's called facet arthropathy. You might see that on your MRI report, that big word, arthropathy. In English, it means that these are becoming arthritic on you. And then become arthritic, like you see in this picture right here. All right, these are the arthritic spurs. They get irritated when the joint moves. And some days you won't feel it as much. Other days they're going to become really irritated, especially if like low pressure systems come in. And then they start to irritate these nerves and you get pain. So if you go the surgical route, okay, or an invasive route, what do they like to do? Well, they like to do a facet injection into it. Anybody ever had one of those? Yeah, so that's where you're going to send in a steroid and some sort of pain management medication to reduce the pain in there. And it can help you feel better at times, but you're not doing anything to fix the facet joint. All right, and in fact, so it continues to get worse. And I'm going to show you something that you can do to actually manage both the discogenic pain and the facet as well with a very high success rate. And that is called spinal decompression. If you've been with me, you know that I've done spinal decompression for the last decade of my life. I dedicated pretty much my entire practice to being an expert in the United States on non-surgical repair of bulging and herniated disc and facet pain. And we use computerized tools called decompression tables to do that. And so when you look over in this left drawing right here, you get a disc that's red, that's being compressed. It's diseased. It doesn't have good blood supply or hydration to it. And as it gets compressed, it starts to irritate the nerves that are coming off from this side right there. And those are usually going to be generators of pain for you. So what spinal decompression allows us to do is it allows us to take a disc that's compressed like this and start to create more space over a period of 12 weeks. And what's that do? Well, that takes that nerve that's getting totally compressed and it creates more room in that tunnel for the nerve to get out, and it frees up the compression on the nerve. And when that happens, usually back pain or neck pain starts to reduce and you start to feel better. And you start to heal from the inside out with over an 80% success rate in most of the research cases. And that's how you do it. And the beautiful part is that, yeah, people would come to my office and have to spend almost $10,000 to get this done. And now, in February, we're going to be launching a program to help you be able to do it from the comfort of your home and for half the cost. So we'll talk about that as we get closer to that. So here's kind of a different view just so you can see. So again, you have this blue is the jelly on the inside of the disc called the nucleus. If the disc tears, that nucleus can come out of that disc to some extent. If it irritates and pushes onto these nerves like you see right here, you're going to get pain. So what spinal decompression do? Well, it helps pull that jelly back in. It's almost like going in there with a straw and sucking that material back in. So we want to control and contain the disc. We want to help try to pull that material back in, and then we want to stimulate the body to start to heal itself. And it takes about 2 years to get it to fully heal. But the cool part is that usually in 12 weeks, most people are either pain-free or dramatically reduced in pain in 12 weeks. It's incredible. So I want you to know that you should be talking to your surgeon about this. And even if your surgeon doesn't even know about this, it doesn't matter. You need to be educated about it because they don't make money doing spinal decompression. They make money doing other things. Does it work? Well, yeah, it works. Take a look at this. So this is one of my patients right here. All right. This was massive disc herniation that he had. See these all the time on Facebook and the Facebook groups. And if you know if you're having chronic pain, you may look like that, and you might look like that at different levels as well. And this is that same person after 12 weeks. Almost no herniation left and totally pain-free in 12 weeks doing spinal decompression. And if you go to most surgeons with that, they probably would do a discectomy or a laminectomy on you. So I don't want that happening to you. You got to try spinal decompression first, and you want to follow someone who's nationally certified in it so that they can guide you week by week, and you can just take the steps, and you'll probably be really amazed at the improvements that you can have and getting your life back. So you stop having those conversations in your head, okay? Of, am I ever going to get better? Am I ever going to be the parent that I used to be? Am I ever going to be the spouse? Am I ever going to go back to work? Is my back ever going to stop hurting me? Am I going to wind up in a wheelchair? You can stop those conversations, okay? So let me show you a little bit of cool stuff. So if you don't know who Dennis McClure is, Dennis McClure was a very famous neurosurgeon in Ohio, and this is one of the studies that he did. So what you're seeing is that a lot of the neurosurgeons know about spinal decompression because they know the unfortunate non-success rate of doing spinal surgery on people. So they're always looking for other options. The orthopedic surgeons, on the other hand, unless they're really well educated and they're up on new things, a lot of them don't know about spinal decompression. So they're not going to be able to give you a lot of information. So don't go in there hoping that they're going to give you, a whole great story in explaining spinal decompression. Most of them aren't. Some of them know, but most don't. So that's why I'm here to help educate you on it. But here's what Dennis McClure saw in one of his studies. Serial MRIs of 20 patients treated with spinal decompression showed up to a 90% reduction of subligamentous nucleus herniations in 10 to 14 patients. What's that mean? That means that jelly that is squirting out sucked back into the disc. He said, we also observed some rehydration detected by T2 weighted images. What's that mean? That means that the disc is starting to get brighter on the MRI. And when it becomes a brighter gray color versus the black, and we go back to here, so I'll show you. So you can see here's a perfect example. So see this disc right here? See the color of it, light gray? See this guy, oh, it's black? Well, when it's black, they're dehydrated. Okay, they're diseased. Even if they're not causing pain, they're in a state of disease. Okay, so they were seeing rehydration on the MRI. I see it all the time as well in almost every case, which is incredible. It means that your discs are actually healing themselves. You're not just cutting out the bad part. And also, torn annular repairs was seen in all patients. What's that mean? That means the outer ring of the disc, okay, this part right here, this outer part of the disc where you can see this is torn, they're healing. And you don't get that with surgery. All your laminectomies and all your microdiscectomies, when I see them post-surgically and you go look at an MRI, they look almost exactly the same. They're not going in to get your disc to heal. They're just trying to create more space to take the pressure off the nerve. So you still have a diseased disc in almost every case. And what's going to happen in 3 to 5 years? You're going to be right back probably to where you are. And I don't want that happening to you. That's why I'm spending the time to do this, okay? So here's another study that is really awesome. So this is out of orthopedic technology. This is a percentage of spinal mobility and pain reduction and activity after 219 patients went through spinal decompression. And what were the results? 86% of them had improvement in their ability to move. 86% had immediate changes and improvement of their symptoms and their pain. 92% had physical exam finding improvements. That means like reflexes improved, motor strength improved, their ability to feel again, balance. All those things improved for those people. That's amazing. Sometimes you don't get that in surgery till 12 months. And 84% of them remained pain-free 90 days after treatment. Why wouldn't you try this? Let's talk about cost for a second. So what's one of the most expensive costs for men and women in surgery? Well, coronary bypass comes in at the top at $151,000 to go get a coronary bypass operation. What's next on that list? Spinal fusion, where they go in and they use some sort of rod or a screw to fuse your spine. You're looking at $138,000 and change. And that's probably a 2-level surgery right there. Every level goes up about $50,000. So if you get an over-anxious orthopedic surgeon who just thinks they should fuse your whole spine while you're in there, you're looking at, I just had one of my old patients who wouldn't do decompression for some crazy reason. He thought he knew better. $575,000 surgery. And I'm going to let you know that most of the surgeries that I'm seeing these days are $250,000 to $500,000. It's huge money for these clinics. So you got to realize, and guess who's paying that? You. If you get better or you don't. All right? And we want you to get better. If you get just a laminectomy, I shouldn't just say just a laminectomy because there's no such thing as just a laminectomy, like a minimize that. I want to minimize it all. That's where they cut off the back part of the bone right here, okay, the lamina to make, I don't know if you can see that, I hope you saw that. So when they cut off this section of the bone right here and right there and remove this piece called the spinous process to create more room, that's called a laminectomy. Laminectomy surgery, $52,000. And that's probably for one level. I have patients that have 4 levels, 5 levels. They've had all that done. And the worst part is that they still had herniated discs afterwards that were putting pressure on the spinal cord and the nerve branches. So now they got to deal with all that and they're still not better. So you're going to be able to do the course that we're offering for $4,995. So you're going to be able to save yourself a lot of money and almost triple your success rate and be able to do it from home with 0 surgery. And you know what? And if it doesn't work, you can always go get surgery, but you should always do spinal decompression from someone who's trained first. Otherwise, you wind up looking like this. And I don't want you looking like this, okay? That's not good. What else? Why also should you look at investing in yourself for 12 weeks and doing spinal decompression from your home? Well, because you don't have to worry about failed back surgery syndromes. And what is that? Well, failed back surgery syndromes is when there is failure in terms that describe a condition of not having a successful result after back surgery and experiencing new or persistent pain. New or persistent pain. In other words, it's when the outcome of the back surgery does not meet the pre-surgical expectations of not only the surgeon, but the patient as well. And what else do you need to know about this? Did you know that nearly 1 in every 50 back surgery patients dies within 3 years of surgery? Did you know that? Doesn't happen with spinal decompression, I'll tell you that. The death rates are significantly higher when analgesics are involved, and check this out, the mortality rate increases 7-fold if they put any sort of cage device in, if they used analgesics. Well, I'm sure they're going to use analgesics to put a cage in your spine. And there's time and places for spinal surgery, so I don't want you to think that I'm bashing on spinal surgery. Hey, if you get into a bad car accident, some sort of major trauma, you're playing sports, you have crushed vertebrae, so things along that line, you got to go get surgery done. That's the only way you're going to heal and get fixed. So there is a time and a place, but that's about probably 10% of most back pain generated issues for people. The majority of them are, again, bulging discs, herniated discs, and facet arthropathies that can all almost be very well managed successfully without any surgery whatsoever in about 12 weeks. So what causes failed back surgery syndromes? Well, back surgeries that are performed for the wrong reason causes failed back surgery syndromes. i.e., a doctor mistakenly diagnoses surgery for back-related pain when, get this, when non-surgical methods could have been utilized to rectify the pain and discomfort. It says most patients are initially satisfied with the results of their back surgery, but eventually become failed back surgery sufferers as scar tissue forms around nerve roots. The installed hardware becomes painful and adjacent segments become degenerated. Even surgeries that are performed 100% technically correct can leave patients with residual pain as a result of back surgery. Surgeries that are inadequately performed lead to the same result, and hardware or fusion malfunctions within the back can also lead to failed back surgery syndrome and chronic pain, like you see in this person right here with a broken screw. Oh, I'm so sorry. I'm not showing you that slide. Okay? That's how you get it. You don't want to be one of those candidates. It happened to my uncle. My uncle had a decent life, had back pain, wouldn't do it naturally, wouldn't take a natural approach, went and got surgery done, and now he has no life at all. Lives on pain medications. Really sad. And I'm sure that if you got kids, you probably watched this movie, Home Alone. Well, this is the father in the movie, John Hurd, found dead. Why? Well, it said a representative for the veteran actor said he was recovering at the hotel after a minor back surgery that he had Wednesday at Stanford Medical Center. Now, this wasn't just this past Wednesday or today. He died from it. You know, as my coaches used to always say to me, you know what the difference between minor surgery and major surgery is? Minor surgeries only happen to other people. So you got a choice. Hundreds of thousands of dollars on one hand, recovery, possibly not getting better, not being able to live your life again, having to recover with big, huge scars, hardware in your spine that usually will probably lead to some form of failed back surgery syndrome in the next 3 years. Okay, all of that, or being able to help your body heal and improve its function from the inside out over a period of 12 weeks from the comfort of your home without any surgery, without any injection, without having to put you to sleep in a surgical room and everything that goes along with that. Does it take time? Yeah, of course it takes time. Rome wasn't built in a day. Your spine doesn't heal in a day, and it usually didn't degenerate in a day. It took years to get you there. So if you take years and say, hey, if it only takes 12 plus weeks on average to deal with something I've been managing for over 5+ years, That's great odds, right? To help you get your life back, to start having those conversations in your head about, am I ever going to feel better? I've tried everything. Well, if you haven't tried decompression taught by someone who's nationally certified in it, you haven't tried everything. In fact, you missed one of the biggest things that someone should have done for you and to help guide you, all right? Because the people that know it, there's lots of research behind it to show how well it works. And someone should have told you about it. And I'm sorry that they didn't, but I'm going to tell you about it to help bring some hope back into your life, to help you realize that, you know what, there can be a light at the end of this road for you, at the end of this tunnel for you. You can recover. I've had thousands of patients do it. I have hundreds of pre and post MRIs that I could show you as well. Testimonials of people starting to go back to work, start to be able to pick up their kids again, go on a vacation, that, you know, their spouse and them dreamed about, and they just realized they were probably going to have to stop. Putting the crutches away and the walkers away and the wheelchairs away, not having to use those anymore because you heal from the inside out, right? And does it require some maintenance? Yes, it does. The body is designed to be maintained, okay? You know what happens if you eat fast food and you don't exercise? Add 10, 15 years of that, your blood levels are going to be off, you're going to be super overweight, probably going to be a diabetic, right? So what's going to happen? So the spine is an area of the body that was designed to be maintained. And so after the 12 weeks of intensive work, I teach you, we have a course on how to maintain it and keep it that way so you don't ever go backwards. So I hope that this brought value to your life. If you know someone that is suffering with back pain, I hope that you'll share this. Please share this with them. They need to know this information because most of the orthopedic surgeons don't know about spinal decompression, and they should. They're ignorant on it, but you know, that's okay. I don't know everything about a surgery either, even though I've worked at 2 surgical centers and volunteered. I can't always tell you what's going to be the best surgery for you and exactly how to go about doing it and exactly what tools we're going to use. That's not my specialty. So their specialty is in spinal decompression. So it's hard for them to answer questions on that. It's not that they're bad people. They're amazingly smart people. It's just they don't have knowledge on everything. They go to school to know how to do surgery. That's why they're called orthopedic surgeons and neurosurgeons. They learn how to do surgery. They don't learn about decompression, but they should offer it. And they should tell you to go do it for 12 weeks. And if you're not any better, we'll schedule you for surgery or we'll look at other options. You should do everything you can before you have surgery unless you're in an emergency state, okay? So I hope this will be helpful for you. Hey, if you like this information, you feel like it adds value, subscribe to our channel. I'd appreciate it. And I can also answer your questions for you. So leave me a comment or a message if you have any questions, if I can help guide you. That's why I'm here. I appreciate you so much. Thanks for being with us again on Back Talks. We'll see you next Wednesday at the same time on YouTube, 1 o'clock. All right, guys. Appreciate y'all.